Hi there, I'm Yossi Abraham, and welcome to CX Tech Talks, sponsored by Zappix. This is a conversation where we bridge the gap between AI and customer experience. Today, we are very happy to be joined by Dr. Abha Agrawal. Dr. Agrawal is a transformative healthcare leader at the intersection of healthcare leadership, policy advocacy, and technological innovation. Most recently, as the president and CEO of Lawrence General Hospital in Massachusetts, she spearheaded a rapid financial recovery, secured vital public funding, and led a historic hospital acquisition. Efforts not only that stabilized the critical safety net for the institution, but also preserved access to care and saved a lot of jobs for the entire region. With fellowship training in clinical informatics and over 25 years of practical experience in health IT, she has a deep understanding of the impact of artificial intelligence and emerging technologies in reshaping science, practice, and delivery of healthcare. Welcome, Dr. Agrawal. We are very excited to have you here with us today.
Thank you. It's my pleasure.
Thank you. So let's start by learning a bit more about you. Can you share a bit about your background and experience?
So you have covered a lot of ground in your introduction, so I would not repeat it. I've been in healthcare for about 30 years, and beyond the work that I have done, I'm very curious and intrigued by the extraordinary challenges that we have in healthcare in this country. Uh, when I joined my training, AIDS was at its peak, and I thought that's the biggest challenge. And globally, we came together, we solved that challenge with tremendous scientific progress and research and innovation. The If I look back on my notes for the last 20 years, various presentations, stuff I have written, we keep talking about the same things. I was actually doing it when I was preparing for this conversation. Escalating cost of healthcare. Now it's going to be close to $5 trillion, over 21% of the GDP. Quality and safety are nowhere where they need to be, given the amount of money we spend on healthcare in the United States. Still, about a fourth to one third of this very, very high dollar amount is wasted with inefficiencies.
Yes.
And we still do not have a stable, financially sustainable, very distressed healthcare system. So, this is an extraordinary opportunity for us to see, can some of these intractable problems that have eluded a solution be enabled, be helped with a technology solution, right? Including artificial intelligence. But I say this with a caveat, because we thought the same thing with EHRs. We are recovering from that. So, tremendous cautious optimism, and I'm looking forward to this conversation.
Yes. Thank you. And you mentioned the AI, and everybody has different definitions of AI, but I would like to ask you, if you needed to explain what is AI to your mother or grandmother, how would you do it?
So this is really a great question, and I also have a teenage son, so I was thinking of them, right? So what? So let me talk more about how I would explain it to my mother or my grandmother. So I would say AI is sort of an evolutionary progress. It's an evolution. So first, we were doing things like writing a letter with a paper and a pen. So these were analog objects, physical things that I could touch, I could feel, and I would hold in my hand. Then the next step in this evolutionary progress was converting these analog physical objects into digital items. So a letter no longer would be a physical piece of paper written with a pen. It would be pixels arranged on a screen that I couldn't hold, I couldn't touch. But so everything physical, all of these things became digital. We lost some, but we gained a lot of things by doing that. I would never lose a letter. I could have multiple copies of the letter. It will do spell check for me. It will do grammar check for me. It will email the letter immediately. And by the way, my 85-year-old mother is a super power user of WhatsApp. So it enabled communication, all this digitization. But we lost a few things with that, right? I don't know. I'm of the generation where I wrote letters, your emotion, you put a little perfume on the letter, a little flower petal. So we lost some, but tremendous benefits we gained. Then the next step in this is AI.
Yes.
And what I mean by that is in the second phase, I'm still writing the letter when the digital. Now, what if AI had access to all my previous letters, all my previous emails? It analyzed all of those, the websites I visited, the books I read, and say, now I understand how you think. I know your format and style of writing. And actually, I don't need you to write the letter. I would write the letter for you automatically because I have learned about you.
Yes.
Not only that, I know what kind of movies you like. So I would go ahead and book a Mission Impossible, the final reckoning ticket for you in the movie theater, right? So that's now AI where digital has been taken to the next step of automation. And since now the other thing about it is it is very good about self improvement,
That's
which is,
true.
by the way, every grandmother and mother's dream for a child, right? So it will learn from the mistakes it makes, it will ask me for feedback, and it will, without me asking it, it will automatically improve itself, right? Now, the problem with this is, not the problem, what if we made it even more? Not only it analyzed everything about me, all the knowledge that's out there on the internet, all the other websites, videos, and then wrote the same letter we were talking about, right?
Yes.
So that's kind of how I think I can explain it to somebody who is trying to put this in some broader context. Problem though is, which we see even in healthcare, is my letter going to sound very mechanical to my grandmother now? She is going to say, I know, but this is not you.
Yes.
This is written by a machine. It is not the same emotion. And reason I'm bringing it up, this issue is very much at the heart of physicians using AI and what it means for the patient. And we'll share more about that. What if it makes a mistake? What if it writes some factually incorrect thing, not just insensitive things? What if it makes a mistake, right?
Yes.
So those are the kinds of things that how I view AI in a very, very simple manner.
Okay, that's very interesting, and that's always a question of when I try to explain AI to my parents or my teenage kids. It has different answers to the depends who you talk with, and also based on the advancements that were published in the recent weeks, whether it's creating new videos or creating new poems and so on. But on the business side and the enterprise side, there are so many different advancements that we'll speak as later on in this conversation. But still looking at the personal experience. So what is your so far personal experience with AI and how has it grown over the last few years?
Yeah. So let me talk about it both from a personal experience as a human, but more importantly, my personal experience as a healthcare professional
Yes,
interested in what's going on in healthcare. So if we look at what AI is doing in healthcare to help address all the challenges that we talked about, it offers something incredibly unique that we have not seen in any previous generations of technology. And that's what is causing all the excitement since November 2022 when ChatGPT came
yes,
out. So I kind of put in a few categories of these things. The first, I think that is very unique and that has been around for a little bit longer than ChatGPT, is the AI's ability to recognize patterns, do
yes,
that pattern analysis. And not only that, it can obviously do pattern analysis that we were doing before, but it is able to find hidden patterns that are invisible to the human eye just because of its compute power, its ability to ingest endless amount of data and that compute power. So it's able to find those hidden patterns that we were not able to see before. I'll give you some examples. So pattern recognition is perhaps the most useful thing in all the image based specialties. Radiology, within a minute, it can tell me whether this is not a hemorrhagic stroke, send the communication to the entire stroke care team, because in stroke time is brain, and say it's not a hemorrhagic stroke, you can go ahead and give TPA. So it reduces that time from 45 minutes to 2 minutes,
Yes.
because it has read hundreds of thousands and millions of CT scans and can give you that. Similarly, it can read pathological images, but then it goes a step further. It says, okay, it looks like a liver tumor, but it is able to look at the pattern and say this liver tumor is of subvariety A or B that you can't see with human eye even under the microscope. Interestingly, it's looking at things that we have no idea how it's doing the correlation, which is both good and bad, right? That's the
Yeah.
black box nature. Looks at the retinal images, which we use to diagnose diabetes and hypertension. And it says, no, I can tell you whether this patient is going to develop Alzheimer's. We
Wow.
have never used retina for that. EKG for heart failure,
Yes.
heart, right? We don't know, but because it is reproducible prediction, so that's pattern recognition is perhaps one category. The second very exciting thing that you are hearing a lot more is the generative AI,
Yes.
where it is being able to produce notes for physicians, right? We know the pajama time, the curse of the pajama time, physicians are spending looking at a computer and not looking at the patient, which has been a source of tremendous discontent
Yes.
for patients, including myself when I'm a patient. And now they can look into the patient's eye, have a conversation, and let the computer take care of all the documentation burden. So that in a generative AI where it is generating text, but like you mentioned previously, someday it could generate images for training, someday it could generate videos for explaining a medication side effect to the patient. There's no limit to what generative part of AI can do. Then another category is predictive AI, where it can predict something before I was able to see. So one prime example did that is sepsis. Very common.
Yes.
Unfortunately, 40% mortality. It's a global problem, not only in the US, very high mortality. And not only that, if you intervene early, you can reduce that risk of death. So that's a prime candidate. And also, there are hundreds of dynamic variables that go into that. The patient's history, blood pressure, pulse, rising, going down, lab tests, medical records. So AI is smart enough, it can be lurking in the background. I could be doing other things and send me an alert before I know it to say, hey, ER care team, I think this patient is going to develop sepsis. I believe so. And why don't you start some medication, some antibiotic? The last piece, which, well, there are a few other things, would be all the administrative aspects of it, right?
Absolutely.
And on that, you hear a lot about denials management, summarization of the record, back office, etc. But the one that I want to talk about is the patient experience, which I think you have focused a lot on.
Yes.
I can say, having been, as I mentioned, in healthcare for several decades now, healthcare industry is not designed around the patient still, right? We have made progress, we are talking about it, but from any moment, any experience is not designed around what the patient writes. So we see as a result very high no-show rates in our clinics, in our subspecialty clinics, in our operating room. Why? Because a primary care physician says patient should need a cardiology appointment. And what does the clerk do? Just sets up cardiology appointment for Wednesday at 2 p.m. We have no idea whether patient can come in on Wednesday at 2 p.m. And then we send them a reminder and then they don't show up. So then a specialist access, which is so limited and so difficult that time slot gets wasted. So then
Absolutely.
what do? We double book it. And then what do? The patient shows up. And then we make the patients wait. It makes no sense whatsoever. Actually, so I know you guys do a tremendous amount of great work on that. Um, I recently came across something, it's published about a week ago in NEJM about Australia's experience with large scale national virtual front door. And they're calling it, which I really like, right care at the right place for the first time, in the first time, right? Because we always say right care,
Yeah.
right place, right time, but they're saying when the patient has the first touch with the healthcare system, right, which is that phone call that they call, right? That's the first thing they are going to do,
Yeah.
probably a phone call or an email. That should take care of the right care, right place in the first touch. And that national large scale virtual front door, it doesn't look as glamorous about sepsis prediction at times,
Yes.
but to a patient, that's the first experience, and that's critical as well. So I want to make my last comment on the use cases.
Okay.
I think the direct care, diagnosis, and treatment is probably not there yet. Not there yet. I'll give you one example. I was seeing a patient, um, and this patient was seen by virtual care completely, no human involved. And the patient called me and say, well, I said, well, didn't you just have a consultation done a few hours ago? And he said, yes, but I disagree with the diagnosis. I said, I thought maybe it was another physician, whatever. She said it was just a virtual thing. So I looked at the pictures. I looked at the transcript of the virtual care, and he was absolutely right. The pictures were of this part of the finger, proximal part of the finger, and the system diagnosed it as if it's a nail bed problem. Um, so accuracy, I mean, I'm glad he decided to call me or call somebody to,
Yes.
and they were courageous enough to say, I don't agree. Um, but it could be, so therefore, direct care without human in the loop, I think we are not ready for yet. There are examples galore. So
Yeah.
anyway, that's kind of what the lay of the land is looking like. For now, there are many more layers, but let's keep
Yeah.
getting.
Oh, I like your categorization of pattern recognition, Gen AI, predictive AI, and then the admin aspect and the patient experience. And because I think this really gives a nice overview of AI and the potential of AI in healthcare as an overview. But if we zoom out for a second, what do you see as the main challenges for the healthcare providers that they are facing today?
Yeah. So we kind of touched on it a little bit in the very beginning. So if you talk to healthcare leaders and physicians or people who are actually day in and day out, uh, uh, and not just patients, of course, patients too. So if you look at it, 39% of the hospitals have negative operating margins, according to Kaufman Hall report. I mean, that is a very tenuous state of the industry,
Yes.
right? And we could talk about why. There are many, many reasons. Workforce. I have never seen this level of concern about workforce. We don't have enough physicians, we don't have enough nurses, CT technicians, you name it, we don't have them.
Yes.
And also, they are leaving in record numbers. Physicians, nurses, not only are they retiring, they are leaving. They are reporting discontent. I know burnout has become an overused word, but I'm not easily given to, I believe in, we should be resilient, we should have a dedication to the profession, all of that. But no question, the system has become tiresome and burdensome for our care teams. We have let, in so many ways, technology drive the workflow,
Yes.
technology drive how my day goes, as opposed to the other way around. I know it would sound a little extreme, but we do have a bit of a phenomenon of the tail wagging the dog, not the other way around. I don't know if you remember I think there was a movie long time ago, so I'm a movie buff, about the tail wagging the dog, right? So and the technology has, I mean, then this is not the only problem, but there is a perceived lack of autonomy. There's a perceived lack that we have too many documentation rules, we have too much paperwork, and all of this is real and legit.
Yes.
I believe the core professionalism of people who are working in healthcare is absolutely intact and admirable. I do not believe this is a generation. I mean, every generation thinks the next generation is, doesn't want to work hard. I'm sure my previous generation thought that. But I see day in and day out their core professionalism and dedication and focus on doing the right thing for the patient is absolutely intact day in and day out. We got to create a better milieu and environment if we want to address the burnout. So those are, I mean, obviously some of the challenges. And last but not the least, the scourge of medical errors that doesn't get talked about is still there. Hundreds of thousands of patients we have, issues with medical errors, misdiagnosis, delayed diagnosis, sepsis, healthcare acquired infections, so I'll one thing that's my pet peeve. We can do all the space explorations and all the incredible accomplishments, and we are talking about we are near artificial general intelligence
Yeah.
and consciousness and sentient AI. But on day to day, on a medical floor in ICU, a patient still dies because nobody noticed that he has a urinary catheter in place that was supposed to be removed within 24 to 48 hours, and somehow it just was there for 7 days, develops. And how is that possible? It's happening today as we speak, right? There's plenty of data.
Yeah.
So there is a dissonance. Sentient AI, AGI, we don't need doctors. Who needs radiologists, nurses? We don't need you. And then yet a human being died today in every hospital around the world. And I'm talking the best test here and the best test around, because somebody just forgot to remove a central line, how is that? So that is the divide we have to bridge.
Yes. Absolutely. And when we're looking at AI, and we're a technology provider, we're a technology company. When we're looking at AI and healthcare, there are multiple challenges we see today still, and as in regards to compliance, PII, and so on. I would love to have your view as a healthcare leader. What are the challenges of implementing AI in a healthcare system?
Yeah. So let's talk first about the environment, which is the system, and then let's talk about the challenges that are more inherent in AI itself, right? So if we talk about the environment where we have challenges, the biggest thing I see is healthcare is this very complex, very fragmented ecosystem, the environment of care itself. And so many people are providing a piecemeal, fragmented solution to one piece,
Yes.
right? But that is what our care teams are tired of.
We
Physicians
want to
and
see
nurses
that.
are telling me, no, 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 please do not make me click again. Please do not make me do more work. And we are not going to buy it.
Yes,
This fragmentation, piecemeal solution approach. And I run into technology vendors
of course.
every day. And I'm like, I know, but have you looked at the whole situation here somehow? So that's in the environmental issue. The second issue in the environment issue, which has been there for a long time, is the integration with the existing system. So if I'm going to have to put, patient information, ADP information someplace else, I'm ADT information, that isn't going to work.
Yes.
And, EHR vendors, they have opened up, they have not. There's this whole drama about how that is going to happen. I think you are smiling. You know exactly what I'm
We feel
saying.
it every day, yes.
It every day. I don't know how one should solve it. I mean, there is so much consolidation. Is it good? Is it? I'll leave it to people who deal with those things, but there is a practical implication of this
Of
on a
course.
day-to-day basis. I think it has also slowed down some of the innovation. If I'm an AI company, I have a great idea. I will actually give you a fantastic example, but let me, which I thought about it, and then I immediately said, I can see 100 problems with this. So before we go to all the inherent problems of AI, maybe you would like this story. A weekend ago, not last weekend, we took a ride on this very famous, the cog train up to Mount Washington,
Yes,
right? So it was kind of a rainy, snowy day with very poor visibility. So we board the train, and there is a train driver who is in the back, and then there is kind of the train navigator. Let's call them two people who are in the front, and they are telling us all the story and all the challenges. And it's a kind of a tenuous, dangerous, thing that you go up on. So here is the system. They do all the check. They had a checklist. They did all of that. And they told us till we give an okay to the driver, they had some signal, the driver is not going to start the train. And I'm like, okay. And they were very transparent. It was all good. And they have not had any accident. And I'm not talking about aviation this time.
yes.
We know. And I'm saying today, as we speak, we still have wrong site surgeries, wrong patient surgeries. We have had Dr. Gawandi's checklist, manifesto, we have had timeouts, we have had all of these things. There is no hospital that doesn't do wrong site, wrong patient surgery, right? We know the stats from the Joint Commission. I mean, if ambient, why don't we put an ambient AI in the operating room? And there is a console outside somewhere, including the patient's family if they are there. Until the console says a green check, the surgeon doesn't cut. Why? Not happening still. I don't see, I mean, I'm not going to do it tomorrow. That's the problem with we have to address the healthcare environment to implement technology right.
Yes,
Problems with technology itself, I think you know that, right? The issue is the trustworthiness and accuracy. I gave you an example of this. Can I trust this for my critical things? Can it does will it get it right? And
yes.
then you have the problem of explainability. It doesn't know why it came up with this. It will tell you different things at different time. It doesn't give you the same answer every time, which
That's
is good if you're writing an essay, writing a resume, writing a college application letter, but not in clinical care. I want the same answer every time.
every time.
You have, I think hallucinations have not been resolved yet at all. Hallucinations
Absolutely.
have not been resolved. Privacy of data, ethics of AI, right?
That's true.
What if it starts to do bad things? Like we know, let's not kill somebody, right? The Ten Commandments or whatever. There is some foundational human values constitution that over millennia there is a commonality
Yes.
around the world, right? There is no culture that says, no country that says thou shalt kill somebody else. Nobody says so.
Nobody.
We have agreed upon
Yes.
some common code of conduct that this is the right thing, this is the wrong thing. We have many many differences, but we have some commonalities. Thou shalt not kill anyone, right? That kind of. But does AI have a common code of conduct? Like, does it know thou shalt not kill anyone? Right? And maybe we need to have. So there's a thing called constitutional AI. So what's the constitution? And then we have US has a constitution. Consider it our boundaries of what we are supposed to do and how and the laws. What is AI's constitution? If it's about to become autonomous, sentient, conscious, whatever, conscious, it better have that before it becomes sentient.
Yes.
So those boundaries, those ethics, trustworthiness, uh, there's good thing is there's a lot of conversation,
Yes.
and I say all the cautious things because I'm extremely optimistic about its value.
Yes.
So cautious optimism is what I think.
I share your cautious optimism. I read a couple of books recently. One is Nexus by Yuval Noah Harari, which
Yes,
I love that book,
my all-time favorite authors. He's one of my all-time favorite authors, right?
and it talks a lot about, first of all, I loved your example of writing a letter on a piece of paper and then the digital, because he really talks about that evolution of information technology, and he also talks about what are the guardrails we need to keep around AI and so on. And the other book I read was Co-Intelligence by Ethan Mollick, and he speaks about how AI should coexist with humans and how to keep the human in the loop. And I think that's part of how we overcome some of these challenges, especially in healthcare. Keep a human in the loop, keep the right balance between the AI and the humans. And I also believe in a phased approach. I believe, start with some level of automation and then start to apply more and more AI capabilities and Gen AI capabilities in those areas. But if you complement a physician with AI, but have it as a supporting tool and not as the primary decision maker, then I think that synergy is very, very powerful.
I think you are absolutely right. I think a lot about this issue as well, because in the very early stages when ChatGPT came out, there was some study that was published in JAMA to say AI wrote answers to patients' questions simulated, and they were perceived as more empathetic. So
Yeah.
AI is more empathetic than physicians. That is just really absurd. So it could string along a few words that indicate empathy,
Yes.
but that's not empathy.
Uh,
Empathy, and I'm not going
yeah.
poetic here, but as you know, I recently lost my dad, and I
Yeah.
talked to a lot of people. Where does empathy go? So many friends said, I know, I also lost my father, and I know how you feel. That shared pain, that shared lived experience, me connecting with a friend to know, I know he or she will understand me because they had the same experience, the same pain. AI has never lost its father, right? I mean, AI, AI has never, had a disease. AI
Yeah.
has never waited outside the operating room, not knowing what's going to happen to your loved one. So, this idea of AI being, can it write words that denote empathy? Sure. But we humans are much beyond that. We know how to detect it's just words versus a true emotion.
Yes.
So I think that this human in the loop is going to be so critical. Do you, as a human, somebody just diagnosed cancer, right? Where your loved one gets diagnosed with cancer. Cancer is kind of such a frightening disease.
Yes.
I don't want an AI agent coming and talking to me, no matter how beautiful words the AI agent is going to use. I want a real flesh and blood doctor.
Absolutely. Yes.
Yeah. So, whatever all the AI proponents are saying about AI, we need AI. God knows we have many, many weaknesses and gaps, but we in the system as physicians. But I think humans still crave that human
With the
connection.
human touch. Absolutely. So one question before last. So when we look at Bill Gates said, I think that we overestimate the changes in the next 2 years and we underestimate the changes in the
That's
next
right.
5 to 10 years. But when we try to look forward 5 to 10 years, how do you see AI in patient experience in healthcare in 5 to 10 years? I'm really, it's almost like a vision which in the pace of innovation today, it's almost impossible to know. But what do you think?
Yeah. So putting my optimistic hat on, and why not? Because our healthcare system has so many challenges already.
Yeah.
So first of all, we are so episodic, acute care oriented. So let's go on a journey like that. Let's say I am a person and I have my longitudinal personalized information hub, which has all my data from my EHR, from my sensors, wearable devices that are the far next version of the Apple Watch or
Yeah.
whatever else, your Aura or whatever else people wear these days. And that personal information hub is there for me continuously monitoring, continuously giving input to some virtualized clinical team, which has all the data, all the literature, and guiding me on a day-to-day, moment-by-moment basis to keep me healthy.
Yes.
And then we go to that right care for the first time, virtual front door concept that you are working on,
Yes.
to say, now we have taken this information, and if you need an interaction with the health system, we will make sure everything is done for you, where there is no waiting anywhere, right? All the drama that we have currently. And then if you are in the hospital for whatever reason, physicians have access to your digital summary. The moment I enter into the patient's room, on a screen flashes your changes to the lab, your last scan result, your pain level, your symptoms, your nurse's note. Right now, we are just distracted with this information gathering as opposed to information present. And all of these technologies I'm saying are available today.
Yes.
I'm not even visualizing. It's actually having the will to put it all together and creating the reimbursement mechanisms to get such a system sustainable. That's where the big if is.
Yes.
So actually, I almost wonder if some of this innovation might be happening or might happen outside the US, where the reimbursement mechanisms to support such innovation may have a better opportunity, better chance. I don't know, but just something to, if I think about it, if we do something along those lines, truly patient centered, truly patient centered, and God knows we are all patients too. I mean, when I'm a physician, I'm a healthcare leader, I'm also a patient. So it's in everyone's interest, right? You know how we now say, imagine doing surgery without anesthesia? Right? Kids, imagine we used to do this to leeching. We used to amputate people for something. We had no antibiotics. Maybe we design a system, the children are going to say, you guys used to wait in the ER for 3 hours just for a cold, just to get a CT scan results.
Yes.
You had people die because somebody misread the CT scan. What kind of medieval ages are you coming from, right? I could see our children saying that to
Yes.
us.
In 10,
And that is
15
the
years.
hope.
Absolutely. Yeah.
And that is the hope.
Yeah.
And I couldn't be more excited about
Yes.
this was redesign, foundational redesign of how we can. It's not about replacing doctors. It's about redesigning the
Yes.
ecosystem of
Yes.
healthcare. So that's kind of my hope that our kids will say someday, what? You used to go to ER to get a CT scan and wait 3 hours to know whether you have a pneumonia? That's absurd, right? And I hope so.
Yeah.
That would be the future.
So last question, based on everything we talked so far about the challenges in healthcare, about the possibilities, the cautious optimism, how do you see a company like ours as Zappix? How can we fit in and how can we complement those capabilities?
I think any innovation, and especially in this day and age, tech-enabled innovation that puts patient at the center of the universe is a welcome development, right? I've had a sign at my desk, by the way, for the last 15 years. And it's a simple wooden block. It says, how does it help the patient? Very simple. How does it help the patient? That should be being a patient-centered universe should be the guiding principle, right? For everyone who is in healthcare, no matter what your role is. You are a care provider, you are an administrator, you are a technology innovator. At the end of the day, we are all here to serve that patient. So I welcome your suite to say, yeah, this is what we are going to make the patient's experience more more seamless,
Yes.
frictionless. One thing, but in that are also tremendous gains to be made by people who are providing and delivering care.
Yes. Absolutely. I really, really appreciate the conversation, and I want to thank you so much for this. And yeah, thank you so much, Dr. Agrawal.
And thank you, Yossi. I really enjoyed it. And thank you for everything you do for the patients.
Thank you. Thank you so much.